Let's be honest, the US has a huge prescription drug affordability crisis. So, in early 2026, the Trump administration rolled out a brand new initiative, TrumpRx.gov, that's supposed to tackle this head-on. The big question is, what is this thing, and is it actually going to save you any money? Well, today, we're going to break it all down.
And that's really the million-dollar question, isn't it? We're going to dig into how this program is supposed to work, who it's really for, and what the experts are saying. By the end, you'll have a much clearer idea of whether this is a real game changer or maybe just a lot of talk.
All right, here's our game plan. First, we'll cover the basics. What even is TrumpRx? Then we'll get into the nitty-gritty of how you use it and what drugs are actually on the discount list. From there, we'll figure out who really benefits from this, dive into the expert debate, and finally zoom out to see the bigger political picture.
Okay, so first things first, let's get a really clear definition of what we're talking about with this new federal program.
So TrumpRx is basically a government website. And this is important. It's not a pharmacy. It's not going to sell you or ship you any medicine. The best way to think about it is like a government-run portal for discount coupons. You find a deal on a popular brand name drug, get a coupon, and then you take that coupon to your local pharmacy.
So the stated goal from the administration is pretty ambitious. The idea is to cut out all those middlemen, the third parties whose markups make drugs so expensive. They want to bring the prices Americans pay for drugs way down, closer to what people pay in other developed countries around the world.
All right, so that's the what, but how does it actually work if you want to use it? Let's walk through the steps. On the surface, it's designed to be super simple, a 3-step process. You opt on TrumpRx.gov, you search for your medication. If it's on their list, the site gives you a discount coupon or a link. Then you just take that coupon to the pharmacy to get the special cash price. Sounds easy enough, right?
So you might be wondering, where are these magical discounts coming from? Well, they're the result of direct negotiations between the government and some of the biggest names in the drug industry. We're talking Pfizer, Novo Nordisk, Eli Lilly, and others. It's all based on something called a most favored nation pricing agreement, where these companies promise to offer certain drugs at these lower prices through the portal.
Okay, this brings us to a really important part. What drugs are we actually talking about here? And are the savings really that good?
When the site launched, it had about 43 brand-name drugs listed. So it's not a massive list by any means, but it does include some of the most expensive and widely used medicines out there.
And for some of these drugs, the savings being reported are, well, they're huge. Just look at the weight loss and diabetes drugs like Ozempic and Wegovy. The site is claiming savings of up to 80–85% off the list price. That's massive. The list also has some very expensive fertility treatments and common meds for things like heartburn and cholesterol, all for cash prices way below what you typically see.
And now we get to the heart of the matter. Who is actually going to see these savings in their bank account at the end of the day?
This chart right here is the key to understanding who this program is for. See, about 85% of Americans already have some kind of prescription drug coverage. That leaves this smaller slice, about 15%, who are either totally uninsured or have those high deductible plans where they're basically paying full price out of pocket.
So, let's be crystal clear, TrumpRx is aimed squarely at that 15%. If you're someone who has to pay the full sticker price for your medicine, a huge discount is an absolute game changer. But for the 85% of us with insurance, well, the math gets a lot trickier. Your insurance copay might already be cheaper than the TrumpRx.
And here is the catch. This is a really critical detail that could be a deal breaker for a lot of people with insurance. When you use a TrumpRx coupon, it's a cash purchase. That means it does not count towards your annual insurance deductible or your out-of-pocket max. So if you're trying to hit those numbers, using this program could actually work against you. As you can probably guess, an initiative like this has kicked up a pretty big debate among healthcare experts. Is this thing truly transformative, or is it just a clever marketing tactic?
The arguments really fall into two main camps. On one side, supporters are saying, hey, this brings price transparency and gives a real lifeline to uninsured folks. But on the other side, critics are waving a red flag. They warn that for a lot of these brand-name drugs, there are already cheaper generic versions out there, and that this program does nothing to fix the actual system that makes drugs so expensive in the first place.
And this quote from one policy analyst really gets to the core of the criticism. They called it largely coupon aggregation, and basically compared the whole thing to private services we already have, like GoodRx. In other words, they're saying it's just a coupon website with a government logo, not a real reform.
And that's a feeling you see a lot in the public reaction, too. While some people are definitely hopeful, a lot of commentators online have been pretty skeptical. They're calling it a marketing repackaging of discount programs that have been around for years.
All right, so let's zoom out for a second and put this whole thing into a broader context, because you have to understand why this was launched right now.
See, this policy didn't just appear out of nowhere. It's really the latest step in a longer push by the Trump administration on drug prices. It follows earlier moves to tie some drug costs to what other countries pay, plus all those ongoing negotiations with drug makers. The launch of TrumpRx.gov is really the culmination of all that work.
And of course, the timing here is politically significant. It's no accident. By launching this program, the administration is planting a flag and making healthcare affordability a signature policy issue, framing it as a major win for American families.
So, at the end of the day, what is TrumpRx? Is it a genuine reform that's going to lower drug costs for millions of people? Or is it more of a clever rebrand of existing tools that only helps a small slice of the population? The truth will probably shake out over time, but for now, you've got the facts to start making up your own mind.